Thank you, Madam CS. Just to add on to the isolation and quarantine facilities, as asked by my colleague, Dr. Mercy Korir, is that we looked at the various designated isolation and quarantine facilities, basically quarantine facilities, and looked at the proportion of people who tested positive from our testing at the various facilities. And where we had significant number of people testing positive, it was our belief that there was local transmission of the disease, and therefore we treated that as an isolation center going forward. And based on that, the day the positive cases were removed from the quarantine site to the isolation or treatment centers became day 0 for the rest of the people under quarantine. However, in conjunction with our case management team, we are reviewing this, and we are also looking at deploying testing on the 14th day or 15th day to be able to see how many of those people turn out negative, in which case we'll allow them home, as I reported even yesterday, in conjunction with the county health management teams to continue self-quarantine for an additional 7 days. For those who test positive, of course, they will proceed to the isolation and treatment centers. Then for the people who are in isolation, the release process is that you must have 2 negative tests within 48 hours, not 24 hours, within 48 hours. And that is what we have deployed in all cases where we have released patients from the treatment centers. Good question, good question. We are developing guidelines for home-based care for COVID-19, and once we are through with the guidelines, we'll be able to quickly bring the county health management teams up to speed so that we can be able to manage mild cases at home. And so far, from the statistics that we have, majority of our cases have been mild to moderate.
You post